If you need ACL surgery, what graft should you actually use for the ACL reconstruction? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide education, information, and commentary on all sorts of sports and exercise, injuries, and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform at your best. You know, I've talked so much recently about ACL injuries in this injuries and surgeries playlist or series for my YouTube channel, and we've talked about ACL reconstruction, where it's a surgery where basically we go in and make a new ACL. We talked about how you can't really do an ACL repair or sewing it back together. But where does that tissue come from? You know, how do we make a new ligament? Well, there's two main choices. We either use tissue from your knee or we use tissue from a donor or a cadaver. That from your knee is what we call an autograft, and from a donor or cadaver, that's an allograft. And there's pros and cons, honestly, to both. The pros of an autograft using tissue from your knee are that it's essentially yours. Your body basically incorporates it very quickly, meaning it turns it into a ligament probably much quicker than it does with tissue from a donor, from a cadaver, an allograft. And so in theory, we might be able to advance the rehab a little bit faster. The problem with it is, you know, it's sort of the robbing Peter to pay Paul. You're taking tissue either from the front of your knee, the middle part of your Patellar tendon, or one or two of your hamstring tendons, and moving it basically into the center of your knee. So you can have pain at the site where that tendon or ligament was taken. You could have weakness at that area. You could have a little bit of loss of motion there. Usually we can overcome all of that with physical therapy, but that is one of the concerns. In theory, it's cheaper. Again, we talked about it's your own tissue, so it in theory might be stronger, it might incorporate faster, and so that's why that's typically what we do in very active people. Certainly high-level athletes, that's very often what we use, is that we use tissue from your knee. That's the gold standard, and that's been done forever. That's not to say that allografts aren't an option. We think somewhere between 10 and 20% of ACL surgeries use allografts as the graft option. And what this is basically when somebody dies, they pass away, and they donate their organs, one of the things that's harvested are some of their tendons and some of their bone and things like that. And so these tendons are processed and basically sterilized to lower the risk of things like HIV and hepatitis B and C, and then they're sent to a tissue bank where then they're stored until they're used in an ACL reconstruction, and that can be a viable option. The surgery itself doesn't change that much in terms of allograft or autograft. The steps and the procedure are pretty much the same, but what becomes different is, again, some of the rehab issues. So when you're talking about pros and cons of an allograft, a lot of times you don't have that donor site pain, that donor site weakness, because you're not taking tissue from your knee. So that appeals to a lot of people. In theory, it's quicker for the surgeon because you're not having not only to harvest a graft from the patient's knee, but then get it ready to shape it into the right size, pass stitches through it, things like that. So the surgery might be a few minutes quicker. Again, less pain, a little bit quicker surgery, and people typically feel better in that first few weeks after surgery than if they had used their own graft. They had had tissue taken from their knee. It's short term, but there are some benefits to that. Now, just because it feels better doesn't mean you're allowed to do more. That's, I think, one of the misconceptions. And if in theory, if anything, you slow those people down a little bit, again, because that ACL graft is not as strong being an allograft as an autograft, especially early on. We think that allografts do take longer to incorporate, and maybe they never get quite as strong as the autografts do. So typically we've been using them in older, less active people, but people that are still active. But the trend is getting a little bit where they're creeping into younger, more active people. We also may use them in revision settings where somebody has had an ACL tear, they tear that graft and need to have a second surgery. There's also a cost to that graft. That's something important to know as well. The biggest risk, and I think this is true with young active people, high school, college, and professional athletes, people in their 20s and 30s that are looking to return to sports, is that we know there's a higher failure rate with the use of allografts. Especially the younger the athlete is, that risk is pretty high. Some studies have it at twice as high, some way higher than that. So that's something to think about. I think a lot of sports medicine orthopedic surgeons that did extra training in sports medicine, it seems like the trend is to going back to using autografts for primary ACL reconstructions, but it's a conversation you definitely want to have with your surgeon about the pros and cons of all the different options before the surgery. Okay, have you had ACL surgery? Did you have an autograft? Did you have an allograft? I'd love to hear how it went. What did you choose? What did the surgeon recommend? So below this video, share your comments, share your experience. I would love to read it, and I bet people going through ACL injuries and surgeries would love to read it as well. If you know somebody that's dealing with an ACL tear right now, thinking about surgery, please share this video with them. I really hope it helps basically provide them information to help them make the decision that's best for you. I can't give specific medical advice in these videos, but I know this information is helpful, so I would really appreciate it if you'd share it with people you know that might be dealing with this. If you like videos like this and you want more information on sports and exercise injuries and surgeries, please subscribe to my YouTube channel. There's a subscribe button in the upper right corner of this page. Click it. I record a couple of these videos every single week, and they'll get delivered directly to you. Thank you so much for watching. I hope this was helpful, and I look forward to seeing you right here in our next video.